Welcome to Healthy and Wealthy Conversations, where we discuss everything that leads to health and wellness for your whole spirit, soul, mind, and body. Hi, welcome to another episode of Healthy and Wealthy Conversations. Today's conversation is with Dr. Teresa Cody. Let's get this conversation started. All right, so first tell us a little bit about yourself. How did you get started in the field that you're in?
Well, I've kind of changed careers in the last few years. I am a trained dentist and I have a dental office. And my husband is a dentist as well, and we have a couple of associates. So lucky for me, I got to retire. So I opened a wellness center about 3 years ago, and it all came about because of my hairdresser, which sounds pretty funny. But she had a very, very hurt hand, from doing the repetitive motion and of cutting and drying hair. And she really couldn't even make a fist with her right hand. So she said, I think I'm going to get another steroid shot. And I said, you can't do that. You can only do that 3 times in any one place. And she said, oh, why? And I said, because it destroys everything in there. And out of my mouth flies, why don't we try PRP? And what PRP is platelet-rich plasma. And since we've been friends for 30 years, she said, okay. So the next week, I brought her into the dental office and I drew blood and then put PRP, the plasma portion, into her hand where all the trauma had happened. And because coincidentally, in dentistry, we have used platelet-rich plasma for 30 years. So we use it for bone grafts. And I didn't know exactly what it was doing, but I knew that if you don't put it in a bone graft, you don't get bone. And then you don't get an implant. So I said, let's try it. So she said, well, how long do you think before I see anything? And I said, I don't know, 6 weeks. Because in dentistry, we put it in and we close the area up and we don't go back and touch it for 3 months. Well, the next day she sent me a picture and her index finger and her thumb were touching. Well, let me see, that way. And I went, oh, because she was this far away trying to make a fist before that. And then, so I injected her hand on Monday. And on Wednesday, she sent me a picture like this. And that's when I went, okay, I got to know all about this. This is very interesting. So that was my journey into platelet-rich plasma.
So, the email says that you help people recover from past surgeries and past injuries and surgeries. So, is that the process you use to help people who have issues in their body due to surgery or injuries?
Yes, we have discovered. So platelet-rich plasma has been used in dentistry, like I said. It's also used in horse medicine quite a lot. They have very long ligaments and tendons, and ligaments and tendons don't have a lot of blood flow. So what this is doing is concentrating your healing factors, which are all in the plasma. They've found 15 so far. There's probably many more. And what I've assessed is that they are the directors of healing. So for example, there is a growth factor, which they probably should be called healing factors, that attracts stem cells. And then there's another healing factor that directs the stem cells in what to become. Because what happens is a stem cell, if you had it in a laboratory in a petri dish, it would stay a stem cell. You need the plasma to direct it. So we have used platelet-rich plasma to help people recover from surgeries. We have injected an area that had surgery, and a patient that was in last week comes to mind. She had carpal tunnel surgery, right? And so while she was still numb, I actually went to her house and injected the area around it. And the doctor told her it'd be 6 months before she completely healed. And she just told me last week, she said, I know it helps so much, because she said, I was completely better in 8 weeks. She said, I had full strength, I could open cans. And, but we use it for any kind of injury. Like today, my nurse injected a few shoulders for rotator cuff injuries. Like they're torn, they're not completely torn, so they have a chance of healing. We've done torn ligaments on toes, plantar fasciitis. We feel really good about it because we draw blood from you, right, and put it in a centrifuge and spin it, and the red blood cells fall to the bottom of the tube, and the plasma and the platelets are sitting on top. So then we can pipette the plasma off and then inject your plasma into you. That's why I wrote a book, You Healing You, because it is you, and it's you're not going to reject it. It's you going back into you. But the idea is you're concentrating the healing in a location that's hurt. And we really do find that the plasma is, well, look, it was made by God, so it actually works. It works all the time. And if people, the worst really that could happen is nothing gets better, right? And what we find is if the patient will rest the area after it's injected, they'll heal up. If they insist on pushing the area, then kind of overrides the platelet-rich plasma. So we have had some, not failures, but they didn't get help, but they also got injected and built a shed the next day. And you're like, no, you're gotta let it heal. You've already heard it, and you've probably heard it for a while. So we also do aesthetic treatments with it. And, you know, because people are vain. Right. We want to look good. So we also do a thing called the vampire facial. And we literally inject your plasma into your face, and it makes your skin look better and younger.
Cool. So talking about the book, You Healing You, the process of this PRP is that in the book, and does it explain it into details for those who might be wanting to know more about it?
Yes, there's a chapter that goes into more details on the science of it. And I figured I'm interested in that part, but you could skip that chapter if you're not interested. But it's literally a blood draw like you would do a lab test. Like we take 1 or 2 tubes of blood and put it through a centrifuge and take off the plasma that's lighter and sitting on top of the red blood cells. So it's fairly easy.
And so far from your patients, has this been a long-term thing where they don't have to continue doing it? Is it a once or twice thing, or is it continuum?
It depends on the injury, and it depends on what they want to accomplish. a lot of people get one and done. They get so much better with one treatment. Other people, they're really so hurt that the first treatment, you get a certain amount of healing, but if you do another treatment, you get even more. The cosmetic treatments, the aesthetics, those women come back and do it over and over. Wow, we keep aging every single day.
I see. So I also see on your website that you also have um, vitamin injections. What does that do?
Well, we do some vitamin infusions. It's amazing the difference between taking vitamins, a pill form, and infusing it and putting it in your vein. It's very, very impactful on health. And we do a general vitamin infusion called a Myers cocktail. And that's B vitamins, vitamin C, a magnesium, a chloride, calcium. It's kind of a general overall infusion for health. And then we have other things that are specific. We do have phosphatidylcholine, which is your brain, 50% of your dry weight of brain. So people like it, makes them feel better. And glutathione, which is the most powerful antioxidant that we have in our body. So, and we have alpha lipoic acid. I mean, we can really get anything. It's so I have a set of patients that come once a week. Some come every 2 weeks. Some come once a month. But obviously, they feel better because they keep coming back.
So back to the PRP, is this done in other places, or are you basically right now the only one who does it?
No, no. This was done in orthopedics for a long time. And it was done like before they closed you up in surgery, they used PRP. But insurance won't pay for it. So I've heard from nurse friends that they don't offer it anymore in the hospital because insurance dictates everything. But there's other people that do this. Yes, this is really not that new. I just think that people don't know how good it really is. I mean, you just heal up. Like we have had people with scars. They have to be relatively new, right? Like within 3 months, just because of the way the skin heals and lines itself up. And it'll take a scar completely away, completely. Like you see nothing. But once the collagen lines up on a scar, I haven't seen it been able to heal that. But we keep trying different things.
This is well, amazing to me because I wasn't aware of this. So my last question for you, is there anything else you would like to share with the listeners as far as what you do? And I see you're in Texas. For those who are in Sugarland area, anything else you would like to say to?
Yeah, this is the Houston area. Sugarland is a suburb of Houston. And I also do Botox and filler and other aesthetics. But I've just found that the platelet-rich plasma does more for the skin than anything. And you know, I'll tell you what it does for, I just turned 60 this year. It's just crazy. How'd that number get up here? And I think what besides fine wrinkles and that, I mean, you have to have a few. I'm 60, but it makes the skin glow like you're 20 again. And there's a glow that people get, and it just looks so healthy, So we have had a blast. I have a nurse on staff, and I have a medical director, and it's just been so fun, to have a treatment that actually really does work most of the time. And for all things that need to heal.
Yeah.
And it knows where to go. If we can get it close, it goes, you can just see it go in, and it goes and it heals whatever it needs to heal. So it's been a blast. Because dentistry didn't always work, because I'm doing it, and it's human made. So it's been very, very fun. And I think that's why I get out and I talk about it, because people don't know about this. And it's really available to all of us. It's in us. All we got to do is find a practitioner that will put it in.
Awesome. Well, I will say, compared to what 60 looked like 20, 30 years ago, you do not look 60.
Well,
So
thank
you definitely.
It's called maintenance. You got to do a lot of maintenance. But I tell women, you change the oil in your car, take care of yourself too. So yeah, but it is work to stay trying to look healthy, but healthy and well. I mean, when you're not well, I think it's the most important thing. Staying healthy and looking your best and feeling your best.
That is all the time we have for you today on Healthy and Wealthy Conversations. I want to thank our guest, Dr. Teresa Cody, for stopping on by, and you, the audience, for watching. Thank you.